The children, for the babies, some of them are from congenital, from the pregnancy.
Wow.
Yes.
A baby
maybe
comes
malformation.
out with kidney problem.
Yes. Depending on maybe malformation. Probably during the fetus formation in the womb, maybe the kidney wasn't either underdeveloped or undeveloped or it's not in the right place.
Okay.
Yes. But for the young children, we have this issue in them from what AKI infection. We have infection, especially the acute kidney disease, bacterial infection. That is why, as a parent, if your child is complaining, when I pee, I have pain, you have to look into it. The doctors are there. You can talk to the doctors. Don't just attribute it as, oh, why? And maybe probably your child is not urinating. Just the urine flow is reducing and you are like, oh, maybe you're not taking water. You can talk to the doctors. And then you see your child, the face is becoming puffy, the abdomen is coming out, it's protruding, and then the legs are getting swollen. And some parents attribute it as my child is gaining weight.
Yes, I was going to ask, how do you tell the difference?
Exactly. Some parents attribute my child is gaining weight. But when you seek medical advice, you'll be able to know the difference, whether it's weight or there is a problem.
Right.
Because, yes, the onset of the kidney for the children, you see they have a puffy face, their abdomen, their
legs are getting swollen. How common is this kidney diseases in children? For adults, we hear of it, you know, the cost of dialysis and all of that.
Yes. For the children, it's now common. Like I said, from infection, that is why when your child is sick, you come to the hospital, you do labs, they're able to tell you some things. And then the children, we are trying to advise parents too much of this fizzy drinks and to give the children healthy diet. And then more water instead of the drinks that we give them.
Where do they get the infections from? Is it like, as you said, a normal bacterial infection?
Yes,
surroundings?
Yes.
Or what?
The bacterial infection, we have the urinary tract infection, and then some of the bacterial infections these children get, it can lead them to kidney. Yes.
Kidney problems.
Yes.
Okay. You said some of them come from the womb having this problem.
That's congenital.
Do you also have hereditary? Maybe their parents, their grandparents. Okay.
Yes.
It's a possibility.
Oh yes, genetics.
Okay. How do you protect the child before they are born and they start developing these things as a parent?
That is why prenatal care is very important. Yes, as a pregnant woman, if you are always going for a pregnancy care, do your scan. They are able to detect these things from there.
Are there other parts of the body that, if the kidney is not functioning, it can affect in children?
Oh, yes, they tend to have hypertension. They tend to be anemic.
Children having hypertension?
Oh yes. Kidney disease can lead to hypertension in them.
Wow.
Yes.
Okay. We've been joined by Dr. Anastasia Prosorova. I hope I got the name right. Good morning. Welcome to the show.
Thank you.
Nice. What are the treatment options that are available? Juliet has told us, you know, how you can have kidney diseases in children. But what are the treatment options? Is it the same as the adults?
So it depends on the cause of the kidney disease. I think Sister Juliet mentioned that sometimes infections of urinary tract can cause kidney damage. So when it starts from there, we always want to prevent. So first of all, of course, we educate, but if it happened already, especially it depends on the age of the child. So in smaller children, within first year, boys and girls, initially boys have higher chances of getting urinary tract infection, and then girls take the lead. So basically, if it is infection, we have to investigate what particular pathogen causes this infection, and then based on those urinary tests we give antibacterial medications. Again, I think associated problems, Juliet also mentioned hypertension. So basically, apart from targeting the main problem, you have to also take care of associated problems. So if it is high blood pressure, you give medications for that. or if we are talking about chronic kidney disease. So usually when we are talking about chronic kidney disease, it means that disease progressed for more than 3 months. So the child, maybe the child has already been born with this problem, or the disease started and it lasted for more than 3 months, and then now child developed chronic kidney disease. If it is, we are lucky and we caught up the disease when it was in acute stage, we call it acute kidney injury. In that case, we have some protocol. Usually we are taking care of the fluids, what child needs to take in, how much urine he produces, and then we are looking for associated abnormalities, because kidneys is not only organ which takes care of the water, they also take care of the waste. So if kidneys do not work properly, then the waste will be accumulated inside our body, and it will be difficult for body to take rid of these toxins or some particles which are not supposed to be in our body. In that case, we look at the child and then we use the medical treatment. But if medical treatment fails, then we have to progress to the next step, which is dialysis. And dialysis, again, we have different modalities. We can use machine, which called hemodialysis, or sometimes we put a catheter, and as Juliet is saying, it's a peritoneal dialysis. And then again, if child still progresses, so the kidney disease still progresses despite this management, then we observe the child, and at some point the kidney disease can reach end stage, and at that point, if the child is at end stage, he or she has to be on dialysis for the rest of her life, hoping for renal transplant. So we are talking about transplantation of the kidneys.
Before you tell us all about how transplantation works, Juliet, how often do you see this in the hospitals, and why are we having this, problem? It used to be that just the malaria, and
on a
diarrhea,
daily
normal, yes.
We see these things now on a daily basis. We have children with kidney failure. It's rampant. That is why I said that it's come back to we the parent. Gone are the days we used to live with our grandparents, we eat healthy things and stuff. But these days we are in the new gen world. So the things we expose these children to, and the things we believe as parents, as Dr. rightfully said, your child is sick, your child has infection, and instead of you to seek medical help, maybe a friend will tell you, oh, try this one. And we know that even some of these medications have an effect on the children, you see. So the things we expose these children to is what that leads them to all
So
this.
when a child is sick, parents shouldn't just go ahead and administer their own first aid, because these drugs could also cause a problem.
Yes, I think you just seek a medical attention.
Go to the hospital.
And some signs you see, you don't sit on them and try to solve it by yourself in the home.
Okay. Dr. Porosova, do you see, for kidney issues, we do hear people try to treat it with herbal medicines as well. Are there any cases like that for the children, delayed response time to the hospital?
Yes, we see these cases, and it depends also on the age category of the child. So in child health, we are dealing with patients of different ages. So for smaller, let's say babies or neonates, and then the infants, they are usually born with congenital problems. So they usually already have the structural problem whilst mom was pregnant with them. So when they're out, sometimes they may present with big abdomens. The abdomen can be distended, so it can be big. Or sometimes this problem, kidney problem, can be associated with other structural problems. So you look at the child, and the child looks a bit different from other children. So we call it syndromes. So the child may have other features or other presentation apart from kidney problems. In those cases, maybe the use of herbal medications is not as not frequent as in bigger children, because imagine bigger child, and usually in bigger children between the ages of 1 and 12 years, we commonly see condition which is called nephrotic syndrome. And in that condition, child will present with swelling of the whole body. So usually it starts from the face and then it progresses. So the face, the limbs, the abdomen, you can imagine the genitals. So the whole child will be swollen. Of course, not be able to eat, even the movement will be a problem. In that case, we see a lot of people, a lot of parents, caregivers seek an advice from herbal herbalists, or maybe, yes, so going to the herbal shops and then acquiring some medications. Again, we are not saying that all herbal preparations are bad, but you have to be careful, especially in this child, the kidney has already been affected.
Right.
And now, even how the body takes care of medications will be different from the child who does not have any problem. So in this case, in this child, the kidneys will not be able to bring out all toxic substances of this herbal preparation. So basically, the damage is already there, but you are giving something which the body cannot take care of, and it will worsen the condition of the child.
Wow. Juliet, I mean, for our African setting and how you already attributed a big child looking healthy, you know, they think that the child is eating well, what are some of the advices that you can give to parents to be able to detect this early? And is there even possible for total cure of a kidney condition in children?
Yeah, I can say yes and no, because as we said, we have acute, we have chronic. Yes. The acute, when you come early, is detected early. You can be treated and then given some medications, and as time goes on, the child will be okay.
Better.
But when you get to the chronic stage, as Dr. Wright said, definitely this child have to be on dialysis. Yes, for the rest of our life, or go for transplant, kidney transplant. So if you see your child, all of a sudden, in the first few months, the child is puffy, abdomen protruding, legs swollen, you know, and this child keep telling maybe I have headache. Every time this child is because as we said, some of the complications hypertension. So if the child is hypertensive, the headache starts. This child is constantly complaining, I have a back pain. When I'm urinating, it's painful. I want to urinate, I'm not able, it's coming small. As a parent, you have to seek medical advice as soon as possible. And the earlier they detect it, at least you'll be able to be treated.
Save the child's life. Dr. Prosova, the transplant, how is it done? And is it easy even getting a kidney for a child?
As we speak now, we are not doing, let's say, routinely or frequently transplants for children. We do it for adults in Ghana, but we do not do it for children. So first of all, some of the problems, why is it so? So how to get the donor? There are two ways of getting a kidney. So it can be a deceased person. So the person maybe was involved in road traffic accident and the brain is dead, but the organs are still functional. So in that case, you retrieve kidney and then you can use it. But again, due to some cultural things, it is, I can say, mostly not possible. That way of getting kidneys is a difficult way. And then the other way is to get kidney from a living donor. So mostly it is close relatives. So it can be a parent who donates kidney, or it can be a sibling. But again, it is not so easy because we need to do some tests to see whether there is matching between the patient and then the donor. Again, the cost involved, we are talking about a lot of money, thousands of dollars, only to do this procedure. But
$1,000.
It is more than thousands, it's thousands.
Thousands of dollars, okay.
Yes. So, but procedure itself is not the end, is not the successful story. After the kidney is put inside child's abdomen, child has to be on some medications which will bring the immune system, the protective system of the organism of the child down. Otherwise, it will be rejection. So the body will just reject because it's an artificial material or artificial organ you are putting in this child's body. So the child has to be on those medications for a long period of time. And due to all these circumstances around the process, it's really difficult.
Wow. So prevention is the best way to go. Do not let it get to that point. Juliet, let's wrap up with a call to action. Since we are marking World Kidney Day 2025, what is your clarion call to parents, to partners who are supporting, the institutions that help children with kidney diseases?
Yeah, I am pleading to parents, organizations, partners. We have parent first. They should help us protect these children, their kidney. We tell the children that their kidney is like a superhero, their tiny kidney, because it does a lot of work for them. So we know that it's a superhero for them because a healthy kidney is a superhero because it's filter all the things we eat. It has to filter our blood, bring out the heart. So if the kidney is affected, your powerhouse is down. So we encourage these parents to take care of these kids, feed them well. If they have infection, report to the hospital. And to organizations, those we can help. We have babies, we have children who have end stage that needs help. If they can help, to be appreciated.
How can they reach you or whoever needs the help? Where should they go to?
Dr. Prosova.
Yes, we have a Pediatric Society of Ghana. I think at the beginning you mentioned that we have a website where you can donate. You can also reach to any of executives if you want to discuss something. You can come to the healthcare facilities and donate. So basically, we really need support because I think it was mentioned that currently what parents can do for their child, that's basically what is done. We do not have constant support. We do not have much which will be covered by National Health Insurance, even though we have some support from National Health Insurance currently because some of the sessions of dialysis are covered by National Health Insurance for children. But again, we need more and more. And of course, prevention is the key. But if sometimes it is not possible, if the child is born with some particular kidney problem, it is very difficult to do something in some particular cases, and the child will need to be started on dialysis and look for transplant very early in life. So we hope that we will have some partners, organizations who are interested in supporting children and basically giving them a chance to live.
And to the parents, they should help the parents because their medications, their labs,
they're expensive.
They are very expensive, so they can help these parents to save the life of their kids.
Thank you so much for speaking to us this morning, marking World Kidney Day, and we've been understanding kidney diseases in children, the acute versus the chronic, and what you can do to prevent it, the signs and the symptoms: swelling of feet, puffy face, weight, hypertension. So if you notice anything abnormal in your child, you would want to rush to the hospital immediately and get the experts to check on the child, run some tests, and advise accordingly. Do not wait for the child to get to the chronic stage and the end stages where they're looking for support, because as Dr. Prosova has said, lots of dollars, thousands of dollars go into treatment, transplant, and you wouldn't want your child to have to go through this. But if you want to support them as well with children who are already facing this kind of condition, you can go to the Pediatric Society of Ghana. They have a website, and they are all over in our general hospitals as well. I've been speaking to Dr. Anastasia Prosorova. She's General Secretary of the Pediatric Society of Ghana. So it means that we even have one of the executives here, and Juliet Osei Waziri, who is Senior Nursing Officer for Child Health at Kolebu Teaching Hospital. I am Maltiti Saida Sadiq. Thank you for listening. We're back with more on Tuesday's edition of GTV Breakfast. My costume is by Yumu Grandeur.